Sweden and Pakistan are now reporting cases of the new variant of the Mpox days after the World Health Organization declared the virus a public health emergency. And now experts in the UK say it's inevitable that the latest strain will show up there.
This new strain of Mpox that started off in 2024 from the Democratic Republic of Congo, but's now spread to at least 9 neighbouring countries, will come to the UK because of international travel. That doesn't mean it will spread widely within the UK because in the UK we have the ability to diagnose and do contact tracing and also to provide vaccination to people who have been exposed.
The outbreak is centered in the Democratic Republic of Congo, where hundreds of people have died and tens of thousands have been sickened by the virus this year alone. The virus is spread by close contact with an infected person or animal. And joining me now is David Munkley, Zonal Director for World Vision in the Democratic Republic of Congo. David, thank you very much for joining us.
Happy to be here.
What is the situation like in Congo?
What we're essentially facing is a crisis on top of a crisis, because in the DRC, and more specifically Eastern DRC, there is ongoing violence, which has resulted in millions of people displaced. And what has happened is they've really set up these internally displaced people camps around Goma throughout North Kivu province. There's up to 2.5 million people displaced. And in these conditions, there's large amounts of sexual abuse, child abuse, unsanitary facing. There's not enough, hygienic Eastern DRC, but really across the country in other pockets is the perfect conditions for an epidemic to grow. And as such, that's why we're seeing these cases continue to rise.
David, I'm afraid we're having...
Because the conditions are really
Sorry,
allowing
David,
for them to
I
do
don't
so.
mean to interrupt. Could you repeat that? You were cutting out there. We just couldn't hear that last part.
Sure. Essentially, these Mpox cases going up so high are because the conditions that we're facing in internally displaced people camps around Goma, around North Kivu, hosting refugees from Central African Republic. These conditions are so difficult, high levels of sexual abuse, and again, very poor hygiene practice, that as such, these cases continue to rise because there's so few mechanisms to really defend against this epidemic.
And I imagine these people are already vulnerable health-wise, and children are really at risk. I know we don't talk about that here as being an issue, but children there are really being hit by this.
Almost 40% of the suspected cases, I believe, the death of people from Mpox have been children under 5. Because again, in these conditions, you have high levels of malnutrition. People are eating sometimes once a day. So when you get something as simple as, malaria, or in this case, Mpox, you're seeing the cases go higher because, again, people have poor health. They have weakened states. And as such, without this knowledge of how it's passed or how to prevent, again, in these camps, it's really the perfect conditions for the numbers to keep going up, up, and up. And as you might know, DRC shares borders with multiple countries. So you've heard about other countries on the border with DRC also having cases. This is all connected in that way.
And what do you need now? What do organizations like yours need?
Well, we're already on the ground. We're in the camps because World Vision has been active during this conflict, again, and with essential food and cash support. So much of Mpox is going to require, again, hygiene promotion, improved sanitary conditions, working again hand in glove with communities to ensure that these programs are funded. Because again, the conditions continue for conflict. So we need to continue to be active in these camps. I know that the World Vision Canada has been a long partner of the DRC, working in emergency conditions in fragile contexts. So really what we ask is continued support because there's so, like I had said, hygiene promotion, finding vaccines, getting more vaccines. We're woefully underfunded for those, and working again with communities to find local solutions. Because if we're not taking care of this in the DRC, this is going to continue to be a national, a regional, and an international problem.
Okay, David, thank you very much for joining us today and talking to us. David Munkley.
Thanks so much.
David Munkley is the Zonal Director for World Vision in the Democratic Republic of Congo.